A new pill to treat COVID-19 appears to cut the risk of hospitalization and death by 89%, even in cases caused by the Omicron variant. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Thank you so much for being with us.
Hi, Dr. Ellerin. The manufacturer Pfizer says the pill could be ready to distribute within weeks. How does it compare to other treatments you're already using?
So, Shannon, this is exciting news. And remember, this is something in addition to vaccines. Vaccines and boosters are preventative, but this is about treatment. So what this medication has shown is that it can reduce hospitalizations and deaths by up to close to 90% in high-risk people, and in moderate-risk people by 70%. These are very good numbers. When we think of monoclonal antibodies, those can prevent hospitalizations by up to 70%. So I think these are all going to be sort of companions and just extra tools in our toolbox to help fight this terrorist virus.
Yeah, Dr. Ellerin, you know, when you say that, there's going to be people that are listening to your answer and they're thinking, hey, I'd rather take the pill then, right? What would you say to them?
I'm glad you said that, Shannon, because what's really, really important is this isn't either or. This is both. We want people protected at baseline because if you've been vaccinated or boosted, you're going to have less likely to have severe illness. Then if you take this pill in addition, if you happen to get infected, you're less likely to get hospitalized even more. So I think it's both. One thing I do want to say about the Pfizer medication, though, you have to get it in quickly. So you have to test within 72 hours, meaning if you have symptoms, the key is getting tested right away because the best results were when people started the medication within 72 hours of the onset of symptoms.
That's important to know. And let's get to these questions from viewers. Nancy writes, I'm immunocompromised with a serious medical condition. I got my third vaccine dose in mid-August. Now, 4 months later, I'm very worried. Do I need another shot?
I know what Nancy is talking about. And, you know, when we talk about the fourth dose, remember, for immunocompromised patients, it's a different story, all right? We have to be very aggressive. We know that you need at least 3. Now, what I would say is CDC says after your first 2 doses, you can get that third dose within 28 days. If you were to get that one right after, then it makes sense 6 months later to get a 4th dose. For most patients right now, most immunocompromised patients, though, they're still on that 3rd dose, which is being recommended 6 months or so after the 2nd dose. So the question is, I think she's coming upon that sort of 4 to 6 month window right now. I think it's about time that she talked to her providers about potentially getting a 4th dose. The other thing I want to say is there is some data right now on a certain monoclonal antibody by AstraZeneca called Evusheld that basically can prevent COVID-19 as pre-exposure prophylaxis. So you give it before you're infected if you're immunocompromised, and over a 6-month period, you reduce your likelihood of getting infected by about 80%. That's most important for our immunocompromised and vulnerable people who may not be responding to the vaccines as we would like.
Okay, that's good to know. I want to give you another question from a viewer here. This is from Jen. She says, since February, I've had shots to prevent shingles, the flu, and COVID. Is it too dangerous to get too many vaccines in 1 year?
This is an easy one, Jess, okay? So the bottom line here is that the answer is yes, it's okay. We have so much experience giving multiple doses to our children and to our adults. Millions of times we've had patients come in where we give them multiple doses at the same visit. The answer is we have plenty of data to say it's safe, it's effective, and I'm really happy that she's getting these vaccines because they're very effective. And now there's no better time than right now to be boosting our immunity.
All right, Dr. Ellerin, thank you so much for your useful information.